Hi friends, morning. I'm Dr. Ashutosh Gupta and I'm a consultant in fetal medicine. So today we are going to talk about a very important topic which is called as an isotretinoin and pregnancy, right? So isotretinoin is a vitamin A derivative and this drug can be taken per oral through the mouth or can be used topical, meaning thereby that onto one's skin, right? So this is sort of a fat soluble vitamin, so derivative, meaning thereby that it gets absorbed into your adipose tissue and to the fat and all the stuff. So meaning thereby that the absorption is very good and can be applied topically, that is onto the skin, onto the acne, recurrent acne, and regarding this recurrent acne, it can be taken through the mouth also, right? Right. And but the traditional understanding has been that it is a category X, and therefore it leads to a lot of congenital abnormalities, multiple congenital abnormalities, and it is been identified as teratogenic and category X, right? But then this drug is being used sort of an commonly by the females, and therefore, and that sort of an the precaution that probably the contraception or she should not conceive within 3 months of the drug use is the usual statutory warning whenever somebody is prescribing this drug, but this is being sort of missed, and many a times we identify that she has conceived off and on these drugs, and therefore the pregnancy is there. Now she has taken some drugs, and whether it is topical that she has applied onto the skin or whether she has taken oral, and now she has conceived, right? So now the situation is this, that how we really can do a triaging, meaning thereby that outrightly whether we should ask for the irreversible call or irreversible decision regarding the pregnancy, because we do have had the history of this drug exposure, or probably you want to do some more sort of an examination to the baby and then probably take an informed choice, right? So we have had this one case, and and then we are doing absolutely great detail ultrasound at level at 12 weeks in first trimester, and then probably we'll discuss how do we manage this case further up, right? So now we have identified that isotretinoin is a category X, can lead to common congenital abnormalities, could be craniofacial, cardiovascular, central nervous system, can have other abnormalities also. It is a vitamin A derivative, right? But now this is the fetus. This is at 12 weeks and 2 days, right? So nasal bone, right? Upper lower jaw, nuchal translucency, right? And then the hand, so this is this is the hand, and we identify the fingers. Another hand, right? We could identify the fingers, both the lower limbs and then the feet, no club foot. Then we look around for the belly button, which is an umbilical cord insertion, absolutely great, right? And then probably we'll recheck the baby again and again, so thumb and the fingers for one hand, right? No micrognathy, as a matter of fact. The another hand, right? So the baby is very active and moving. No craniofacial, as a matter of fact, abnormality. We'll just try to look around for the ears. So now the baby is very active and moving. So baby, we are just checking for the lower limbs once again, right? And then the hand and the thumb of the second of the contralateral hand, right? And then and then this retromicrognathia ruled out, nuchal translucency, the whole spine. Now we see the diaphragm, and what you can see is this stomach bubble. So no sort of an esophageal atresia. The whole spine. Now we are focusing on to the kidney. So this is what we are identifying is a renal fossa, and we could identify both the right and the left renal parenchyma, right? And then the lower jaw, right? Okay, and the head, right? And both the ears, and then the falx cerebri, four chamber heart, right? And then with the LVOT, this is the lower jaw, and just a small glimpse was there. So this is the belly button, the umbilical cord insertion, and then the kidneys. So we are rechecking it again, right? We are just making an effort so as to see, we are revisiting the baby again, so revisiting the whole of the congenital abnormalities whatever we can see at this 12 weeks and 2 days, right? So four chamber heart, belly button, thigh bone, knee joint, and both the feet, and then the lower jaw, four chamber heart, right? And the ears, both the ears, neurosonogram, we identified the IT and then the cisterna magna, right? And the nuchal, and right. So the left hand complete, right hand complete, right, and the whole spine, right. So that is what it is. So it looks very very reassuring, right, and then the nasal bone, right, and the whole spine, and so that is what it is. And then we would probably try to look around for the neurosonogram, right? And then both the ears, and then we can see the eyes and the lens also. So both the lens of the eyes are being visualized, the ear, bilateral ears, no macrotia, four chamber heart. So no obvious congenital, major congenital cardiac abnormalities, right? So at this stage, clavicle. So whatever we try to look around for looks normal to us. So this is a common scenario, meaning thereby that somebody has prescribed, some physician has prescribed this isotretinoin, and then she's taking per oral, and in the meantime, this is all, we are all humans, and therefore the lady can get pregnant in the meantime when she have had this exposure of this drug, and so meaning thereby taking an irreversible call straight away that she have the exposure of the drug doesn't cut the ice, as a matter of fact. Okay, so meaning thereby that this is the genetic sonogram that we are doing at 12 weeks and 2 days, right? So meaning thereby that we try to look around for almost everything that probably we could have looked around for as far as the congenital abnormalities associated with isotretinoin is concerned. Right now, why on earth would we believe that probably a thymic or a parathyroid hormone or parathyroid gland aplasia can happen in the pretext if we don't have any craniofacial cardiovascular abnormalities is there, right? So we could see both the ears, we could see the lower jaw, we could see the diaphragm, we could see both the kidneys, we could see the whole spine, and the basic four chamber and outflow tract abnormal outflow tract of the heart was being looked around for, and the baby was absolutely great and moving. There was no sort of a skeletal or a craniofacial abnormality, so it is very very reassuring, right? First, secondly, 4 weeks post LMP or 2 weeks post conception, it is called as an all-or-none phenomenon, right? So meaning thereby that the baby conceives in the fallopian tube, right? And then it gets transferred through the fallopian tube into the endometrium, into the uterus, and then it embeds into the endometrium, right? And therefore at day 21 to day 23 it gets connected to the tertiary villi, meaning thereby that it gets connected to the mother. So up till day 21 post conception, the baby is on its own. So baby is getting all the nutrition through the yolk sac. So baby from day 23 gets in contact or gets some sort of an contact with the maternal blood. So whatever drug that the mother have had has had, right? Okay, so that would get into the blood, would get into the uterus, would get into the endometrium, and by day 23 only, we would identify that the baby can have that exposure to that drug, because then the baby or then the embryos would get into contact with the maternal blood, right? Okay, so meaning thereby that 4 weeks post LMP and 2 weeks post conception, probably it is called as an all-or-none phenomenon, right? So it looks reassuring to us at the moment, and the statutory sort of a precaution is this, that all the congenital abnormalities, they cannot be ruled out, but whatever max that probably we could have done at 12 weeks and 2 days with the background of the isotretinoin exposure, it is the fetal abnormalities are negligible. Okay, so it is very very reassuring. I believe that probably this is for the first time that we are just trying to triage this isotretinoin exposure and the congenital abnormalities to the fetus, right? Thank you very much for your patience.